So how do we know when we're about to start?
Right now.
Okay.
Hey everyone, happy Friday. Thanks for joining us today. We have Dr. Ekenna and Levon with us this afternoon. And can you believe it, Lee? This is our 10th Facebook Live that we've put together.
It is. And it's also, somebody told me, it's our 40th day.
Oh
So
gosh.
hopefully that's a good moniker.
40 days and 40 nights, is that in the Bible too?
Yep, 40th day.
Well, if you missed any of the ones that we put together, we put them up on our YouTube link, so they're easy to share. Or of course, you can scroll down on our page and see all the information that we've been providing, and we'll continue to provide you as we fight this virus. So with that, Lee, let's have the stats for today.
So today was a very good day, statistically speaking. We only had 2 new positives. And when you average that with the last few days, we have a bit of a trend of a little bit of a downward trend. So we're very happy with that. It's hard to really celebrate because we do still have a few people that are in the ICU that are struggling with this horrific disease. But we're able to play Don't Stop Believing again. We're doing that every time we discharge someone. And hopefully we'll hear that a lot of times over the next few days and continue to see the numbers like that. We do continue to watch what's going on in Mobile and keep our guard up. But overall, today was a very good day. Also, I'll share with everybody, I'm sure everyone saw the governor's order to continue for 7 days. We are very glad that we're doing that. We totally are all about getting businesses back to work, but we've got to find that balance so that we don't end up with a situation where we're overwhelmed. And we think a few more days into this will help us get to a better spot. And then in our strategic meeting today, we spent a little bit of time talking about the Trump reopening plan and how and what we need to do to be able to be prepared to handle that. So we're looking towards hopefully some brighter days coming up ahead.
Yes, preparing for now and the future, which is great.
Yep.
So Dr. Ekenna, he's an infectious disease specialist. What exactly does that mean, Dr. Ekenna?
Infectious disease specialist means basically a physician trained initially in internal medicine, then followed by another 2 to 3 years of specialty training in infectious disease. Remember, I keep saying this, infectious disease is probably one of the only specialties that don't have an organ. So we take care of patients that beginning from hair to the toes. So essentially we take care of the whole patient. We don't have an organ. So you can have an infection that involves or affects the hair all the way to the face down to the toes. So we don't have an organ. It's not like we are specialists in kidney disease or lung disease. So that's really one way to put it.
So before you went to work here, before I knew you, my grandfather got a shrimp stuck him in his hand and got an infection. Correct. It's in your book.
Yep.
And that was before I worked here or knew you. So you can handle anything along the infection spectrum, really. From A to Z.
Well, we'll do our best.
Yeah.
I had no idea it was your grandfather until you told me that.
Yeah.
He was a very nice man, by the way. He actually came personally and brought me the permit to use the permit. Seriously, he brought the permit, signed permit to my office, and I think I must have talked to you. That was your mom, right? That's probably right.
Yeah,
that's amazing.
Small world.
Yes.
How long have you been here? How long have you been here in this?
25 years. 25 years.
You're originally from Nigeria.
25 years in October last year.
Oh my gosh.
Yeah. So
we're glad you're here.
Yes.
Especially during this pandemic, it's great to have a person of your caliber on the team, and you've been involved in every meeting we've had. It's been great.
But I'm glad.
Have you been surprised by this situation that we have here today?
Anybody who tells you that this pandemic is not a surprise to him is probably, well, let me put it this way. We knew it would come someday, but we're still shocked and surprised that it came when it did. Remember, the last big one was 1918, a little over a century ago. There were some smaller ones in between. 2019 was nothing really compared to this. This is the first big pandemic in 100 years.
Wow.
So it is shocking. Now, we thought it was going to be a flu virus. It turns out it is a coronavirus, which is a little bit surprising.
And so the flu, that is transferred during airborne, right?
Well, flu is also mostly droplet, but it can be transmitted airborne as well.
Yes. Coronavirus is not so much?
Coronavirus is primarily droplet. And
what's a droplet?
Droplet, you know the old style, I would say, is 3 feet distance?
Right.
That's how much a normal spit and cough would land in a little bit of droplet. Now, that's in this time we've actually extended it to 6 feet. That means under normal circumstances, a little cough or a little spit should not land on anybody. So droplet means it's a little heavier, whereas an airborne infection requires something tiny, much more smaller particle, about 5 microns, enough to get down all the way to lungs.
So then how is this disease so contagious more than others?
To be honest, we don't know why this particular coronavirus is. It is much more contagious than the flu and than usual thing, and much more contagious than SARS and the other ones.
Does that have to do because it's novel and our bodies aren't used to it?
It is new, clearly new. We don't know everything about it yet. We think it's a zoonosis. It's some form of transformed coronavirus. By the way, coronavirus is a common cold virus that humans have and many other animals, including camels, cats, bats, and so on.
So you would compare it more to the common cold than you would to the flu?
Well, it's a common cold virus ordinarily, but there's something different about it that made it so much more transmissible than usual.
That's what you were talking about earlier today, or it might have been yesterday. I heard you talking to someone about how it gets into your, how it goes into your throat or whatever, the droplets versus the little smaller particles of the droplets.
Well, we think this is all droplet. That's mucous membrane, eyes, nostrils, and mouth. Oh, that's how we think people get it. However, aerosols are generated by certain procedures, and those can be generated basically by the things we do, like bronchoscopies, endotracheal intubation, and those kinds of things, suction. And those are things we want to make sure that we don't do in unsecured areas. And we will do them in a hospital here under negative air pressure.
Everybody with all their PPE and
right,
everything.
And under negative pressure environments, yes. And you have to put on special PPE. Yeah.
So is it more often, that's not something that's going to happen outside of a controlled medical environment. So people walking down the hallway, passing each other, as long as they have some distance between each other, are not as likely to get it as they would something like the flu that's a smaller particle. But this, you really are most likely going to get it from what you said the other day, from contact.
Yes.
Meaning like hugs or doorknobs.
Yes,
or what?
I say hugs, and I want to make sure that we understand. Frontal hugs are not recommended. This is not going to give you the flu, although that wouldn't be considered a real hug. Right. Of the coronavirus. But essentially, the whole point about 6 feet or social distancing, as we call it, is designed to basically prevent a droplet landing on you. If it doesn't land on your face and mucous membrane, you're not likely to get it. And we want, in addition, hand washing means that if you contact it, if you touch something or surface, that you can actually wash off your hands and keep it clean. And we want to not have water, hand sanitizer. Mm-hmm. I prefer to wash my hands, actually.
Yes.
I do too. I feel a lot cleaner for sure. So Dr. Ekenna, you mentioned that medical scientists kind of warned us that this was going to happen because it's just part of human nature or Mother Nature, whatever you want to call it. So what research are we doing here in South Mississippi to help, prevent something like this happening again, or provide the information to them so that they can predict another one?
Well, pandemics happen because of things typically almost outside the control of individuals like us. This one came originally from China, and we think that the environment of the wet markets, animals, and this close contact with humans, with animals, was probably related to how this came about. Now, we don't know exactly, the genome is out, so we know it's a cold virus, a coronavirus, so everybody knows that now. The question is, how did it transform from an animal virus to human virus? What made it become more transmissible from human to human? That is something that is not exactly clear at this stage. Now, with respect to, what was the next question?
What are we doing in our doors to research this disease?
We are basically investigating our patients. We have a number of patients that we're following, especially by very capable navigator nurses. They're actually calling up these people, trying to find a good history, trying to track where they've been, where they may have contracted the infection, just by basic simple, we'll call it contact tracing questions, And I think we're getting some data, and we don't want to get ahead of ourselves, but I think there is some information to suggest that's contact.
So the contact, they call it contact tracing.
Yes.
And normally it's not something a hospital does, but we had some people that with our outpatient volume down, we repurposed to focus on that.
Absolutely.
Some nurses, and they're doing you're meeting with them almost daily.
Right.
And it's amazing the information that you guys are coming out with that I think is going to help people in other places and with other things, because, you find out what was the source of it. How did they get it?
Exactly.
And what is that? There was another term you used, the transmission.
Transmission dynamics.
Transmission dynamics.
Dynamics. Tell us a little bit about that.
Well, this is something, I know something you're very interested in. It's unusual that the CEO is very much concerned about this type of work, but I was kind of impressed. The point there being, we are basically trying to figure out how did this happen? Why is this more common in a certain group of people? Why is it happening? But I think we have some idea as to what's going on. It's probably occurring in places where people are crowded, whether it's be church, whether it's be grouping coming together, which is one of the reasons certain, the governor and all the privileges that are recommending closure of certain activities, barber shop, large crowds in churches, large groups within families, and so on and so forth. So that's the reason for this, just because of the nature of this virus and the way it's transmitted. So we're going to find out there may be more to it. There was an issue in New Orleans about our Mardi Gras. We don't know all that detail yet, but I think we're going to find out from our navigators that, what they're looking at now. There's a lot of data already there that we have not fully analyzed, and that will be forthcoming. I'm guessing that in the next week or two, we'll find some more data.
Yeah, it is very interesting, and I appreciate you guys letting me listen. I have been interested in pushing on that, because I do think it's important for us to find out the sources of it, because it's amazing the things you learn about it. For example, a lot of people thought that they were getting it at work, and that's not the more common case. It's usually at home, funeral, birthday party, things like that, where people seem to be picking it up, and probably from hugs, handshakes, and serving dishes.
Just eating together close by, all those things.
Yes, and these navigators are also helping navigate these patients to not spread to anybody else.
Absolutely. And I think the work they're doing is very, very important. Not only does it reassure the patients, the information should be very useful to the community. Actually.
And the world.
And I know you're giving this information to the local community to help them, address some of these issues. Yeah. And I think that's useful.
Thank
you. It's been fun doing that part of it. Trying to help the community.
So do you think that a virus like this could wipe out mankind? Or do you think we're going to be able to get through this? Is there light at the end of the tunnel, Dr. Ekenna?
We hope not. I mean, the point of the matter, the human being is pretty resilient. There hasn't been a virus or any infection that's killed off everybody. So I don't think that's going to happen.
We're resilient.
But I think we'll get through it. But obviously, it's going to do a lot of damage. It's done a lot of disruption, which is probably the biggest problem. And the disruption is both social and economic. And of course, a lot of people are dying. So this is a big deal. We are going to get more knowledgeable, more resilient. Now we're going to learn a lot at the end of this. I remember the HIV was new when I was a young resident. We had no clue what it was, to be honest with you. And I think Dr. Fauci discussed it many. He spent his life doing HIV work. And so much has come out of HIV that is very useful for many other diseases. So I think we're going to learn a hell of a lot from this.
Well, you've been a great leader for us during this process. You've made a really horrific situation a little easier for us to endure, and made some parts of the research parts of it and the parts where we're able to go out and literally help families in the community with education and community outreach has been good. And that's been on the back of your direction, leadership with Darylyn and Heather and the team. So we appreciate everything you've brought to the table there. And I know we probably need to wrap up, but I'll end with this. There's been a lot of silver linings in this, as there is in any tragedy. And some of those silver linings include the ability I've seen so much interdisciplinary collaboration with you and Dr. Barber and Dr. Roth and all the pulmonologists and the nursing staff and the whole infection prevention and quality teams. It's just been great to see everybody working together for a common good, and with the community. Another silver lining has been it just really shows how important infection prevention and the study of what you do is. I think that one thing that will come out of this, tell me if you agree, is that we'll probably have less flu next year because people will wash their hands more.
They will probably get the flu vaccine.
So,
By the way, this has been a
That's true. I didn't
collaborative effort.
I didn't
Yes.
think about that. That's another one.
They'll probably be amenable to the flu vaccine
Yeah.
next year.
yes, I think
But,
all of us will come out
I
stronger.
think
for sure.
so.
But lots of silver linings, and I hope they do. That would be a very big silver lining. The flu is a tough thing to deal with anyway, but this disease is certainly more insidious, and I hope we can get through this pretty soon. But we appreciate everything you do for us. We are so blessed to have him and all of his people that he collaborates with on our team. Very fortunate here at Signal Rail System. So with that, I think we'll call it a wrap.
Yeah.
And thanks for what you do, and stay Singing River strong.
Thank you.
All right.
Good.
Thanks, everybody.
Thank you.